Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. This is Monday Health Minutes. Panic attacks are fairly common. About 11% of Americans have a panic attack once a year. 2 to 3% have them regularly. So we're talking about strategies on how to deal with that if that is part of your life. We're talking with licensed clinical social worker Michaela Whitlow. Thank you so much for being here.
Thank you.
What are some of the leading causes of panic attacks?
Oh gosh, it could be anxiety. Sometimes they can be triggered by a physical thing going on in your body, and then it kind of escalates into another anxiety. But anxiety is definitely the underlying issue when it comes to panic attacks.
I think people kind of use the term panic attack almost universally. It's like a blanket statement. Mm-hmm. What exactly qualifies it as a panic attack and not just a stressful situation?
A panic attack is a very real and physical thing that happens. And so basically what's happening is your body is overproducing adrenaline in response to some perceived threat. So physical signs are the major factor in panic attacks. So you'll have a racing heart. You sometimes will have shortness of breath, chest pain or pressure. A lot of times people think that they're having a medical emergency, but it's actually a panic attack.
That's a wake-up call for
Very
sure.
scary.
What are some strategies that you can do if you start to experience these kinds of things? We're in that holiday-ish season, so a lot of extra stress, a lot more, stretching your time and maybe sleepless nights getting ready for things. What are things that you can do?
Well, the best way to treat panic attacks is prevention, and addressing the root cause. So whether that be through therapy or through talking with your doctor about a physical issue or medication that might be needed, those are going to be the best ways to treat and prevent any more panic attacks from happening. However, if you're in the middle of a panic attack, you want to do a few things to calm your central nervous system. So one would be deep breathing. So practicing taking slow, deep breaths can calm your central nervous system. It'll slow your respirations, it'll lower your blood pressure, and it will help your body to reach equilibrium again. So that's probably one of the easiest, most popular go-tos when it comes to panic attacks or anxiety in general. And then another thing would be grounding. So grounding techniques put people in the here and now. So these are things that include any of your 5 senses. So anything that you see, smell, hear, taste, touch, you want to focus your thoughts on that. And that helps to get your mind off of maybe things that might be making you anxious and puts you in the present moment, the here and now, so that your body again can reach that equilibrium.
So deep breathing while you're having a candle burning could help you refocus?
Absolutely.
Like 2 senses at once?
Watching the candle flicker, paying attention to this table and looking at the texture and the colors. And I usually tell my patients to practice 5 things you can see, 5 things you can hear, 5 things you can smell, and just kind of go through your senses and notice those things that are around you.
So if that sensory kind of recalibration, if things are needed beyond that, are there medications that can help?
Yeah, there are medications. I'm not a doctor, so I can't prescribe or recommend things, but there are definitely things that can be used both to lower your anxiety in general and prevent them from happening, and used as kind of rescue meds. So that would definitely be something you could talk with either your primary care physician or a psychiatrist that specializes in those things.
Are there ways to avoid panic attacks altogether?
Yeah, these techniques, the grounding, the deep breathing, if you practice those on a regular basis, then it'll bring your overall anxiety down and prevent the panic attacks from coming on as intensely or as often as possible.
Getting to that level. We all have stress, but it's managing that stress and bringing it back down.
Yeah.
Such great ideas. Thank you so much. And I love the grounding, just kind of getting centered. That'll really help a lot of people. Thank you, Michaela.
All right, thank you.
Thanks so much for being here. We'll see you next Monday.